Yeah, I mean, it's an important milestone. I think that probably by the end of this, most people in the US will have gotten to COVID. And certainly I do expect the death toll to increase, including past the, Christmas and New Year's. I think it speaks to fatigue that people are under. Interestingly, South Korea recently announced that it was going to try to live with the virus, and it relaxed a lot of the restrictions. Of course, they then saw a spike, but I think we're seeing this desire to try to return to normal. And, people can return to normal activities as long as they do mask, do social distance, and do practice good hand hygiene, and of course, are vaccinated and boosted.
It's interesting the point that Kate just made, because she said, I think by the end of this, everyone in America will have actually probably had their day with this virus. I think by the end of this, everyone in the world will have done. They'll have certainly have had enough of it, but I'm talking slightly flippantly. We're all going to catch this. Make no bones about this. We're all going to be exposed to this in the coming months to years. And that is the way it's going to be. And the whole question about living with the virus, this virus is going to sink into the background of circulating coronaviruses. There are 4 there already that cause the common cold. But when they first made their incursion into the human race, they produced extremely severe symptoms and they killed enormous numbers of people. Then they became entrenched and endemicized and started to spread just naturally through the population. This virus will be no different. But what we're doing at the moment is using vaccines to short-circuit the system and fool our bodies into thinking we've been seeing this throughout our lives as though we were catching it when we were little, so we have a trivial infection when we're older. And basically, that's the way it's going to have to be going forward. We will, for a while, have to intensify vaccination to keep the oldest, most vulnerable people protected. But in the meantime, we will slowly accumulate immune experience with this virus. And that means that for most people, it will cease to be a threat. It will be a trivial infection that you catch serially over a number of times in your lifetime, but it doesn't kill people. In the near term, we just have to try and keep pace with the vaccines to protect the most vulnerable while that process of natural evolution happens.